In scorching hot and humid weather, your body faces a formidable challenge in regulating its temperature. When the body heats up too rapidly, unable to cool itself efficiently, or when excessive fluids and salts are lost due to dehydration or sweating, it can lead to heat-related illnesses. Recognizing the symptoms of excessive heat exposure and knowing the appropriate responses are crucial. The Centers for Disease Control and Prevention, CDC, offers valuable guidance on identifying warning signs and symptoms of heat-related illnesses, as well as recommended first aid steps. In this video, we will discuss essential tips to avoid heat-related illnesses, including recognizing symptoms and taking appropriate actions. Number 1. Heat cramps. Heat cramps often serve as an initial warning sign of heat-related illness, which, if left unaddressed, can escalate to heat exhaustion or heat stroke. Common symptoms of heat cramps include painful muscle cramps and spasms, primarily in the legs and abdomen, accompanied by heavy sweating. If someone experiences heat cramps, you can offer immediate assistance by applying firm pressure to the cramping muscles or gently massaging them to relieve spasms. Provide small sips of water, unless the individual complains of nausea. In such cases, refrain from giving them more water. It is vital to seek immediate medical attention if the cramps persist for over an hour. Number 2. Heat exhaustion. Heat exhaustion is a more severe condition, characterized by symptoms like heavy sweating, weakness, cool and clammy skin, a rapid and weak pulse, muscle cramps, dizziness, nausea or vomiting, headache, and even fainting. To aid someone suffering from heat exhaustion, relocate them to a cooler environment, preferably a well-air-conditioned room. Loosen their clothing and apply cool, damp cloths, or allow them to sit in a cool bath. Offer small sips of water, but if the person vomits more than once or the symptoms worsen and persist beyond an hour, it's imperative to seek immediate medical attention. Number 3. Heat stroke. Heat stroke is the most severe heat-related illness and constitutes a medical emergency. Its symptoms include a throbbing headache, confusion, nausea, dizziness, a body temperature exceeding 103 degrees Fahrenheit, hot and either red, dry, or damp skin, a rapid and strong pulse, fainting, and even loss of consciousness. In the case of heat stroke, your priority should be to call 911 or get the victim to a hospital without delay. Every minute counts in a heat stroke situation, as delays can be fatal. Move the affected person to a cooler environment, preferably one with air conditioning. Use cool cloths or a cool bath to lower their body temperature, and if the heat index temperature is below the high 90s, you can employ a fan. However, do not offer fluids in this situation.